Shoot.
Doing okay?
Yeah. Oh. That'll wake you up right there.
Yeah.
Oh,
What do you think
that
of
feels crazy. Oh. Oh.
Good. What do you think of that?
Oh man, that's like every bone I have.
That's the everything adjustment.
I feel taller, honestly.
Okay.
I feel a lot taller. I'll say like a little right there.
Okay. So much further than before.
Yeah, I feel like now I can at least to my knees.
Yeah, get it down a little bit better.
Yeah.
So, I was looking at your chart and I saw you've been having some neck stiffness, some lower back pain,
Correct.
and you drive truck, is that right?
Yes, sir.
Okay.
I'm truck driver.
So tell me a little bit about everything that's going on, how everything feels.
Man, I've been feeling this pain for about like a month now, and it's mostly in my left pelvis area, butt cheek, tailbone area. And since I drive a semi all day, I'm usually in a seat just driving, bouncing around, so it kind of just hurts and hurts and hurts. And it's really hard whenever I try to use anything from the waist down, like especially my leg. Whenever I try to put the leg in there for the clutch, it just sends a shock of pain and it just hurts,
Yeah.
man. And it's just I've had back pain before, neck pain, but I mean I've always dealt with that. But this is just like a whole different pain where it's like uncomfortable. I can't even work with. And
Yeah.
at work I throw straps and strap them down, and it just kind of bothers from day to day activities. And I tried going to a chiropractor the other day, but it didn't really do anything good over there. Texarkana. So.
Yeah. And when you went to the chiropractor, did they adjusted your low back and everything? And
I'm gonna be honest, they didn't really do anything to me, man. They charged me a lot, but they were more like they wanted insurance type of stuff. If you didn't have insurance, they didn't really want to talk to you. And I tried to talk to them and do something, and she kind of just touched me here and there and gave me some exercises, and that was about it.
And that was it. Okay.
She really didn't do anything. And I was
Yeah.
like, I mean, I guess.
Okay. Well, I'm sorry to hear that. Was that your first time at a chiropractor?
Yeah, I've never
Okay.
been in a chiropractor.
And they didn't like crack your back or anything like that?
No.
Okay.
I mean, I know it's just the noise, but she didn't touch me at all.
Yeah. Okay. Well, I'm sorry that you had that first experience. Hopefully, we're going to rewrite that for you today and make sure that you get a good adjustment. Let's talk a little bit about everything, though. So, are you feeling like numbness and tingling in the leg? Is it like electric shocks? Is it sharp, burning?
I'll say it's like a sharp pain. Well, enough where it tells you like, hey, stop, don't do that no more. And then whenever it's not the pain, it's just the soreness. A lot of soreness.
Kind of achy and tight.
Correct, 90% soreness, tightness, stiffness, and then like 10% pain. Whenever I try to like I can't even go higher than that. There, it's already sending pain as it is.
Yeah, all the way down the leg.
Correct, yeah, but it's this general area right here, like where I would say where my left pelvis and my tailbone area meet that whole area.
Okay, gotcha.
Anytime I do anything with my right leg, I feel sore, but I mean, this I can do anything.
Not as bad, right?
Correct.
And then what about the neck? Is that just dull, achy, and tight, or how does the neck feel?
Man, the neck's always somewhat stiff, but ever since I got this pain, my neck's been fine. But
okay.
Yeah, it's kind of
almost
weird.
like this is kind of taking all your attention off the neck.
Yeah, because the neck I just usually crack it every once in a while, but I mean, it's not that bad compared to this. This is just unbearable.
Yeah. Okay. Yeah, you rated your pain as about a 7 out of 10. Does that sound about right?
Right now, today's about a 6.
6. Okay, that's
6,
still pretty severe.
Yeah, it affects me just even walking, man. Like I feel like 90 years old.
Okay.
Kind of weird.
Okay, let's start by seeing how well you're moving, and then we'll do a couple of things to see if we can figure out what's going on. It sounds like you have some pressure on the nerve that goes down the leg. Basically, all the nerves that come out of your low back, they then go down into your leg, and all the nerves that come out of your neck then go down into your arm and hand. So when we have irritation or pressure on those nerves, then we start to get numbness, tingling, shooting pains, all kinds of stuff going on in the leg. So just right off the bat, just from hearing you, I think we got to check out what's going on in your low back because that's contributing to that nerve irritation. But we'll see exactly what we need to do here. So let's just start by having you sit up tall, and you're going to bring your chin down to your chest as far as you can. Okay, and then look up to the ceiling back as far as you can. Yeah, pretty stiff there. And then look over the right shoulder, and then the left. Okay, so your rotation isn't terrible, but going back, you're pretty stuck there, and then you got a little bit of stiffness coming down. And then let me have you go ahead and stand up for me. You're going to reach down and touch your toes just as far as you can. Yeah, having trouble getting up too, huh?
Yeah, honestly, I'm not even going to be able to go far back.
Okay.
I'll tell you where I can go. right there, it's already starting to hurt. And if I force myself, I'll take it right there.
Okay.
That's just for you.
All right, and then let's have you bend backwards as far as you can. Okay, so we can bend back pretty far. You just definitely can't go forward. You don't like that at all.
Correct.
Okay. Did it hurt going back like that or no?
No, you can tell it kind of relieves the pain a little bit. I try to
Relieves
sit
it?
face down to try to like compensate.
Yeah. Okay. Okay, so let's do this. Let's go ahead and have you lay face up on the table for me. Your head's gonna go right here. So I'm gonna slowly lift your leg here, okay? I just want you to tell me if you get any increase in your low back pain or any increase in the symptoms in your legs, okay? I'll do all the work, so let this leg relax totally. Perfect. Nothing?
I feel soreness, but that's just from regular you picking up the leg. But
Okay.
related to this pain, though.
Anything like this bring out the low back pain?
No, just stretching.
Okay. And then we'll lift this leg up. Any pain or anything like that? Not really?
No.
Okay. And what about here?
Nope.
Nothing? Okay. All right. Let's have you go face down now. So your face is going to go right here where the paper is. And there's a little handle right here by my foot that you can grab onto. Okay, if I press here, any pain?
Nope.
Okay, what about here?
Nope.
Here?
Nope.
Okay, what about here?
A little bit.
A little bit? Okay. And then what about if I press here into the glute? Nothing?
No.
Nothing in the leg either?
No, sir.
Okay, what about there?
Nope.
Okay. Here?
A little bit.
A little bit? Okay. So I got some irritation on the low back for sure. Not super bad though, because if it was real bad, then when we lifted that leg up, you'd be having a real hard time. Okay. Pretty tight there. Okay, let's have you lay on your back for me again. Pretty tight here too. Okay, so we're going to start with your neck, and then we're going to work our way down, okay?
Sounds good.
So, I'm going to come in here, I'm going to lift you up, good. And let me have all the way to that head, so just let your neck relax as much as you can. Perfect.
Holy shit.
Doing okay?
Yeah.
They didn't do that in the other office, did they?
No, man, I'm telling you, they didn't touch anything.
Okay. You ready for the other side?
Yeah.
Nice and easy. Good. Good. Okay. Let's scoot you down now a little bit. Okay. So, we're going to cross these arms here. Let's have you take a deep breath in. Out. Loose shoulders. Good. Again, deep breath in. Out. One more. Okay, a little tough on that one. All right, how are we doing?
Good.
Doing okay so far?
Yeah.
Okay, so now we're gonna get into your low back. So let's have you lay on your side. You're gonna face me over here. Good. Top leg is gonna be there. There we go. Okay. I'm gonna pull you off this arm a little bit. And this arm I'm gonna go overhead. Try and keep your belly as loose as you can for me, okay?
Oh. That'll wake you up right there.
How'd that feel? Felt okay?
Yeah, felt good.
Good. Let's roll you to the other side. Right here. And this arm goes up. Good. do you think
That
of
feels crazy.
Kind of wild, huh? Okay, so flat on your back for me. We're gonna adjust your hips, and then we're gonna do some decompression with you. So I'm gonna give this a little pull. No pain here, right?
No.
Okay. Good. No pain here?
No. Holy.
Okay. And then we'll have you lift that head up for me and set it down. Okay. No pain there. Okay. Breathe in. Out. Loose.
Oh.
Good. What do you think of that?
Oh man, that's like every bone I have.
That's the everything adjustment. Okay, let's have you go face down one more time and do a little bit of massage going in that low back just to loosen everything up.
Okay.
Okay, so let's have you hop on up from the table and we'll take a look at some of those movements again and just see how everything feels. So first of all, how do we feel just standing up?
I feel taller, honestly.
Okay.
I feel a lot taller.
Okay, let's have you try and reach down and touch your toes again. Don't get too crazy on me, but just a little bit. Go ahead, face this way. Yeah, perfect.
I'd say I'm feeling pain right there.
Okay.
And then also to force myself. I'd say like a little right there.
Okay, so much further than before.
Yeah, I feel like now I can, at least to my knees.
Yeah, get it down a little bit better.
Yeah.
Okay, and let's have you have a seat. And then go ahead and sit up tall. Bring your chin down to your chest as far as you can. Good, and then look up to the ceiling back as far as you can. Better there. Look over your right shoulder, and then your left. Okay, and then try and straighten that leg out and see how that feels.
I don't feel pain. I can't go higher because I physically can't go higher. But,
Yeah, but
I
before
don't
it
know.
was
I couldn't do it.
the pain that was stopping you,
Yeah,
right?
Yeah, I couldn't.
Yeah.
That's as high as it goes because that's naturally. I can
Yeah.
I don't feel any pain here doing that. Just
Good.
like the stretchiness here, but
Yeah.
that's how it should feel and it's normal.
Okay. And when you first came in, you said your pain was about a 6 out of 10. How would
Yeah.
you rate it right now?
I'd say probably just like a 2 just because of the soreness.
Yeah.
But
So
I haven't felt that sharp pain right now.
Good. Yeah, so a little bit of soreness is normal sometimes after the adjustment because when we move those joints real fast, sometimes the muscles get a little bit irritated. But basically getting in there and adjusting that helps open up the room around those nerves, reduce the irritation in the area, reduce the inflammation. And so that'll help take some pressure off so that that leg and those nerves in your leg have time to kind of heal and chill out. And then, yeah, typically what I would do for something like this is I'd see you about once a week for about 6 weeks. And then after that, maybe once or twice a month, just depending on how you're feeling. And so that would be what I'd probably recommend for you. That way we keep getting in there and taking the pressure off that nerve. And what you'll notice is that eventually those leg symptoms are going to go away, and then eventually this will start to go away. So that would be my recommendation.